สวัสดีค่ะ Good morning มากันWelcome to the CPHI Southeast Asia Digital Event. You are with me, Rose Chitanwat. I'm going to be the moderator of the session today. From the CPHI Southeast Asia Digital Event that we are going to run from today till 10 of December, we have variety of the session that covering from drug security, the framework in each country, and even the technical development, which we put the community of the pharmaceutical industry together in ASEAN. So now today we are going to have 1 hour session to focus on the I would say the second largest country in terms of population in ASEAN, which is Philippines, which has population around 111 million citizens in the Philippines. So I have with me our honorable guest that is expert in pharmaceutical industry, engineer Higinio JP Porter, or I can call him JP. He is the group vice president of one of the big pharmaceutical company, Pasco Laboratories, and he is now the president of Philippines Pharmaceutical Manufacturer Association, or we call PPMA. So I have Sir JP with me here. I'm going to introduce the topic Sir JP is going to cover. He will cover about 50 minutes, and we're going to have the question and answer on the last part of the session. The topic will be the Philippines pharma industry amidst the pandemic and restart post-COVID-19 pandemic. Sir JP, welcome to the session. I pass the stage over to you, sir. All right, Sir JP with us here.
Please allow me to have the video, okay?
Yes, please.
Allow me to share my screen.
Please, sir.
Okay.
Yes.
Okay,
sir.
Has it been shared?
Yes.
Okay, amazing morning, everyone, from the Philippines to the rest of Southeast Asia. I would like to thank Informa Markets for this opportunity again to be one of the speakers of CPHI Southeast Asia. My presentation is entitled Philippine Pharma Industry Amidst the Pandemic and the Restart Post-COVID-19. I will briefly discuss what our association, PPMA, is all about. I will present also relevant market data showing the impact of COVID-19 pandemic to our industry and in our lives. I will also show you what supports we got from our government. How do we move forward and what will be the next steps for the Philippine pharma industry? Now, allow me to discuss what Philippine Pharma, the PPMA is all about, or Philippine Pharmaceutical Manufacturers Association. PPMA is a non-stock, non-profit organization established on September 30, 1950. We celebrated last year amidst the pandemic, the 70th anniversary. It was organized for the primary purpose of bringing together entities engaged in the manufacture and or marketing of pharmaceutical products for the attainment of the following objectives. First, to continually upgrade the standards of the pharmaceutical manufacturing industry in the Philippines, to promote and encourage pharmaceutical research and technology development with a view to utilizing indigenous raw materials. Third, to cooperate with the medical and allied professions for the betterment of the healthcare delivery system in the country. Our vision is to be recognized as a dynamic organization in the pharmaceutical industry that will serve as a prime mover in promoting, advocating, and achieving quality and excellence in research, manufacture, and distribution of pharmaceutical products. Now, what are the contributions of PPMA in the Philippine pharmaceutical industry? Our membership are composed of 50 regular members. These are manufacturers, traders, and distributors. 26 associate members allied to the pharma industry. These are raw materials and packaging material suppliers, service providers, and 10 individual members, mostly an ex-member of the Board of Trustees or ex-presidents of the PPMA. PPMA contributes 80% to the Philippine pharmaceutical industry market valued at 4 billion US dollar. Its president, myself, is a member of the Advisory Council for the Philippine Department of Health or DOH and Department of Trade and Industry or DTI. Its president or other members of the Board of Trustees act as resource person during congressional committee hearings related to the industry. We provide continuous technical education to the pharma industry through our seminars and webinars. We provide college scholarship to selected BS pharmaceutical students. Now, let me show you briefly the impact of COVID-19 pandemic on the Philippine pharmaceutical market. As of quarter 2 of 2021, total Philippine pharma market is at negative MAT growth, but rate of decline has slowed down. The total pharma market is valued at 209.2 billion, almost 4 billion US dollar in 2020, a decline of 7% from 2019. 3 years prior to this, the market grew 10% in 2017, 10% in 2018, and 6% in 2019, valued at 192 billion pesos in 2017, 211.7 billion in 2018, and a high of 224.7 billion in 2019. Quarter 2 of 2021, it grew 11.6%, but year-to-date growth is still negative 1.5%. Forecast for 2021 will be benign growth of between 1 to 2%, but it is expected to go back to pre-pandemic level by first half of 2022. Ethical market comprises 66% of the market, total pharma market, while OTC or over-the-counter products has 34% share. OTC grew by 1.7% year-on-year value and 7% in the market share, brought about by increase in the demand of immune-boosting vitamin C, B-complex, vitamin D, zinc, and combinations. Ethical market, on the other hand, suffered a negative 10.7% growth year-on-year and a 3% decline in market share due to lesser demand for antibiotics, cardiometabolic drugs, and oncology products. On the macroeconomics and employment, Philippine GDP grew 11.8% in second quarter of 2021. Significant improvement from Q1 of negative 3.9% prior to the pandemic in 2019. It was trading between 5.6 to 6.6%, but it receded to 0.7% on the onset of the pandemic in first quarter of 2020 and dipped to a record low of negative 7% in quarter 2 of 2020. It improved slowly, easing to negative 3.9% in Q1 of this year and bounced back to a high of 11.8% in Q2 of this year. Quarter 3 data is already out and it was a surprising 7.1% growth amidst the Delta variant surge in August and September. Unemployment is down to 7.7% in June of this year. Inflation rate surged to a high of 4.7% in February 2021 from a lowest record of 0.8% in October 2019. It improved to 4.1% in June of this year, and it is expected to improve further towards the end of this year. Now, let us go to the mode of consultation. The pandemic gave birth to online consultation because of the strict quarantine requirements implemented across the country. First half of 2021 recorded increase in prescription versus previous M, with continuous increase in online consultation. Quarter 2 of 2020 posted highest record of online consultation with 31.7%. Now, let me share with you the impact of COVID-19 on human life, specifically personal and health and family life. It affected so much our mental health, depression due to loss of loved ones, loss of job, anxiety due to fear of getting infected. It gave birth to a phenomenon called Zoom dysmorphia. Zoom dysmorphia is a mental health issue arising from prolonged time spent on mirror or video conferencing, resulting to distortion of our self-image. Looking at yourself for a prolonged period makes you look imperfect physically. This resulted to increase in patients seeking dermatological and cosmetics enhancement. Suggestion in order to prevent this is to switch to video off most of the time during the duration of Zoom meeting so that we won't be able to see ourselves on the screen. It also affected our physical health. It increased obesity due to physical inactivity and overeating. Muscular dystrophy for athletes and gym goers because the fitness gyms are closed throughout the strict quarantine restriction. Increase in sedentary behavior. A lot of family members are hooked on social media and Netflix because they cannot go out of their houses. It also affected our emotional and spiritual health. Physical distancing, we are prevented from touching our friends, doing cheek-to-cheek, hugging and kissing even our loved ones. Social isolation. Frontliners cannot even go home to their loved ones at the height of the strict quarantine restrictions. Social stigma, especially for the infected. If you cough or sneeze in public, everybody in the surroundings will be on a panic mode. We fear being near the house of the infected. Church activities were temporarily stopped. Face-to-face schooling was suspended. Now, the impact of COVID-19 on industry and businesses. Jobs were lost during the strict quarantine period. Mostly affected were the public transport drivers, and these are poor member of the society. 45% went out of job. According to Statistical Research Department, about 34% of Filipinos in the formal and informal services lost their jobs. This has huge impact on our economy because 51% of our GDP is contributed by informal and formal services. We have the highest percentage or the highest population of call centers agents in the world. Formal retail was also affected, 29% went out of job. Informal retail, 24%. And even the banking sector, the financial institution were affected, where 9% lost their jobs. Impairment of supply chain, specifically in the supply of goods and services. Shortage of PPE, sanitizers, immune-boosting drugs, COVID-19 management drugs. India and China imposed moratorium on export of essential drugs. This affected so much our supply in the Philippines for essential drugs because most of our finished goods, drug products, are imported, about 60% of them, and these mostly are coming from India and China. Most affected industries are personal services like salons and spa, retail industries like garments and appliances, gaming, fitness and entertainment, transport, travel and tourism. Our biggest airline in the Philippines, the Asia's first airline, already said they are on the red. So they filed bankruptcy even in the US court. Okay. While negative impact of COVID-19 are numerous, it has its positive effect on environment and climate. Pollution level considerably reduced. NASA satellite image shows pollution level at Wuhan, China. the ground zero for the COVID-19 prior to the pandemic. In only a month of complete lockdown in January 2020, it showed an almost pollution-free atmosphere. And in February 2022, almost nil pollution density. Traffic congestion was eliminated, and ozone layer is repairing. On the field of medicine, various governments, private companies, academic institutions work together to come up with COVID-19 vaccine in unprecedented lead time of only 12 months. Imagine that. Prior to this COVID-19 pandemic, coming out with a vaccine will take you 5 to even 15 years to launch. But because of the cooperation of various governments and several institutions, we're able to come out with several vaccines to be distributed globally. Unfortunately, Philippines doesn't have its own vaccine. We are importing it from other countries. Legacy drug products were repurposed for COVID-19 treatment. On family and community, family members stayed together at home. Many households learn to cook meals for the family and do household chores. We learn to share what we have to those who don't have any. We realize the value of simple and healthy life, going back to basics. We learn the value of saving money for the future. On business and industries, we learn the value of digital connectivity. Internet services, service providers profited huge from it. There was a significant increase in sales of mobile phones and computers because most of the population are working from home. Self-sufficiency, agility, and resiliency. Our government finally realized the need for self-sufficiency and resiliency, especially in the pharma industry, improving the supply chain and strengthening the local manufacturing. Popularity to work from home arrangement. Prior to the pandemic, work from home arrangement for most of the industries are not acceptable. At the height of the pandemic, the most viable option for the office staff was to work from home. Now, a lot of companies are considering continuing work from home arrangement for some of the functions. It gave rise to micro-entrepreneurship. With big percentage of the working class losing their jobs, many started small home-based businesses supplying food, delivering goods, and lot others. Impact of COVID-19 pandemic on the manufacturing and production operations. It led to reduced personnel due to quarantine restrictions and incidences of workplace transmission of infection affecting production output by as high as 50%. Machine purchase needed for production capacity expansion were delayed due to lockdowns at origin and due to logistical challenges, leading to financial losses for the company. Commissioning of new equipment bought abroad were hampered due to travel restriction, not put to use on time for production, causing losses. Increase in production costs like paying hazard pay, transportation, free lodging, free meals, and PPEs. And these have to be absorbed by the manufacturers and cannot be passed on to the consumers because of the economic repercussion. Increase in the prices of raw and packaging materials of up to 50% due to scarcity of supply, especially for COVID-related drugs. Now, how did the Philippine government responded to this crisis? Prior to the imposition of the quarantine restriction in March 16, a day before the lockdown, complete lockdown in Luzon area, we were called at the Department of Health because I'm a member of Technical Working Group on Drug Medical Security headed by Assistant Secretary of the Pharmaceutical Division of Health Regulation of the Department of Health. We meet weekly and during the lockdown, digital, virtual meeting to ensure that we have enough supply of our medicine for our population. And if there are problems, then we discuss what needs to be done and cooperate with different agencies and different pharma companies. Formation of interagency task force for the management of emerging infectious disease or IATF, headed by the Secretary of Health. They were tasked to assess, monitor, contain, control, and prevent spread of COVID-19 in the country. They are also tasked to give guidelines to the community quarantines. Congress enacted Bayanihan to Heal as One Act or Bayanihan Act 1. This is to realign, reallocate, and reprogram budget of 275 billion pesos to combat COVID-19, about more than 4 billion US dollars. Bayanihan to Recover as One or Bayanihan Act 2. This is to provide funds to stimulate the economy while strengthening the health sector and government pandemic response, especially for the small-scale enterprises who closed down their operation during the pandemic, during the height of the pandemic, and they need to restart. So the government provided for them. The government also enacted Corporate Recovery and Tax Incentive for Enterprises or CREATE Act. This is to provide fiscal relief to domestic and foreign corporations doing businesses in the Philippines to stimulate again the economy. The Department of Department of Trade in the Industry implemented Industry Development Program. Its goal is to create a better future for the Filipinos by developing industries and attracting investment that will provide jobs, foster innovation, and improve competitiveness of the local industries responsive to the needs of the global market. Its strategic objectives is trade deficit reduction, value creation, global value chain integration, and social contribution. And these are the initiatives of IDP: investing in support facilities and infrastructure, empowering on capacity building, empowering local industries through investing in human capital development, on ease of doing business, coordinating with relevant institutions and agencies to facilitate setting up of businesses and address specific concern on the business environment. On industry promotion, promoting trade and investment in priority industries in the country through hosting and participating in regional and international events. On the part of the executive and legislative branch of the government, they focus on policy formulation and advocacy. And these are some of them. We crafted a joint memorandum circular for the establishment of a green lane for local vaccine manufacturing facility. I'm part of this as member of the technical working group. It created a green lane to expedite the streamlined process and requirement in the issuance of permits, licenses, and authorization relative to the establishment operation of a bulk import, fill, and finish local COVID-19 vaccine manufacturing facility and facilitate registration in the availment of incentives. Since we don't have capability of research and development to come out with our own COVID-19 vaccine, we partnered with technology innovators from other countries, mostly in China and European countries, and even Russia, for the importation of bulk COVID-19 vaccine, and then do the filling in our country to supply the 111 million Filipinos who needs them. Establishment of the Virology Institute of the Philippines, this is long time overdue. Proposed to be an attached institution to the Department of Science and Technology, and it will focus on key development areas for virology science and technology applications. Coming up with integrated Philippine pharmaceutical industry roadmap. And we envy the automotive industry because 5 years back, they already have their own roadmap. But a very essential part of the industry, the Philippine pharmaceutical industry, doesn't have yet a roadmap. So we are doing that this year. This is to have a single roadmap of the country's pharmaceutical sector with the goal of having Philippine pharmaceutical industry that is sustainable, self-sufficient in providing quality and affordable medicines to be completed this year. Pandemic Protection Act to provide local preference in government procurement, development and promotion of healthcare and manufacturing industry, strengthening the local manufacturing industry incentive, suspension of export requirements, and procurement and stockpiling of critical products. Vaccine manufacturing bill and roadmap, with Asian Development Bank to come up with a bill on the development of the vaccine manufacturing capacity here in the Philippines, not just for COVID-19. To craft a roadmap to chart the long-term strategies to successfully establish a sustainable vaccine manufacturing. Republic Act 11534, or the Corporate Recovery and Tax Incentive or Enterprise Act. This is a new regime on fiscal incentive that may be granted to preferred activities like vaccine manufacturing and other manufacturing activities. This is open not just for local manufacturer but foreign companies that would like to put up manufacturing facilities here in the Philippines. The effectivity of the CREATE law was April 11, 2021. And these are the scope and coverage. It covers all the investment priority areas. IPA shall maintain their functions under the law governing them except to the extent modified by CREATE. The coverage of which are the reduction of corporate income tax rate from 30% to 25% effective July 1, 2020. We are in the ASEAN country, we are the highest in terms of income tax. Corporate income tax rate of only 20% for domestic corporation with net taxable income of not exceeding 5 million and with total assets excluding land not exceeding 100 million. This is to promote small scale and medium scale industries to thrive. New incentives for regime for other qualified projects outlined in the investment priority areas. The approval and disapproval of this incentive based on if the value is below 1 billion pesos, this is under the investment priority areas approval. And for projects with investment capital of more than 1 billion pesos, this is approved by Fiscal Incentive Regulatory Board. Now, there was significant improvement in the Philippine FDA, especially during the pandemic. Implementation of new citizens charter, improving the cycle time of product registration and license application processes aligned to Anti-Red Tape Act enacted in 2019. Completion of registration backlogs by December this year. Pre-assessment process, they implemented pre-assessment process and no outright notice of disapproval. Unlike before, you will apply for you will do application for the registration of drug products, and you will wait for about 1 to even 3 years, and only to find out that it is disapproved, you will issue the notice of disapproval because you have deficiencies in the documents or the requirements. And you again need to reapply. Because of this pre-assessment process, once you apply for the registration or for licenses, you submit documents and they do pre-assessment. If there are deficiencies, then you are given 7 to 14 days to comply with it. And then after complying with it, they do the process. And based on the new Citizens Charter, it should not be for new drugs in medicine. The timeline is about 120 days. And for simple drugs or simple application, up to 20 days only. There was also a COVID-19 pandemic responsive regulation, easing of variation guidelines of COVID-19 related drugs and devices, green lane for local manufacturing registration of COVID-related drugs, and creation and implementation of electronic services. Now, I will show you the situation of COVID-19 in the Philippines. As of yesterday, we already logged 2,832,734 cases. And the cases day on day are reducing, lowering down. And our 7-day moving average as of yesterday is only 779 new cases rather in the past 7 days. So it is already at a level in the same period last year prior to the onset of the Delta variant. In the number of deaths, however, it is still high. We already had, as of yesterday, 48,545,000 deaths, and the number is still high day on day, though the number of new cases are low, but we are lodging more than 100 deaths every day. In terms of recovery, the numbers are good. So as of yesterday, our total active cases is down to 15,800. It is very near to the 12,600 lowest last year after the first wave. These are the graphs showing the weekly cases. So we are now at a level prior to the surge during the first wave. But in terms of death during the second wave and third wave, it is erratic and a high number, double the number of deaths during the first wave. So we already experienced third wave. In terms of vaccination, 32% of the population were already fully vaccinated, about 35 million Filipinos, and 46 million already received their first doses. So the total is 82 million. Before the end of this year, we will be able to achieve the 70% of the population fully vaccinated. Compared with the global percentage, 42.7%, 7.8 billion doses already given, and 3.33 billion were already fully vaccinated. Now, let me go to the economic implications and projection. So it will be a challenging restart in recovery, not just for the Philippines, but overall the ASEAN countries, wherein we suffered so much from this COVID-19 infection or pandemic. So it depends on each country. The different countries might experience mild or moderate recession during this crisis, brought about by this crisis, or deep recession morphing into that crisis. For countries with high economic resilience and short COVID crisis, like Vietnam, Korea, and Taiwan, the impact on healthcare and pharma industries are as follows. Short-term decrease in healthcare consumption, increasing in inventory positions, and rapid demand recovery. While for those countries suffering moderate recession, these are Singapore and Myanmar, sustained decrease in demand and asymptomatic condition, volatility in shop-level inventory. And for those countries suffering deep recession, this is the countries hardly hit by the Delta variant: Malaysia, Thailand, Indonesia, and Philippines. Decrease in sector spends and severe price cuts and outstanding payments. And it might morph into a debt crisis, depends on the emergence of a COVID variant, new COVID variant. Remember, last year, we are already happy that we were able to control the previous variant. And Thailand and Vietnam already celebrated going COVID-free. But because of the new variant, the Delta variant, we suffered so much. Indonesia were the most hit among the ASEAN countries. Yesterday, early this week, it was already announced that there is already new variant called Omicron or Omega coronavirus virus variant. It also depends on the time to market for the COVID vaccine rollout and the overall economic resilience of each country. Countries who will morph into debt crisis will suffer severe austerity measure post pandemic, leading to a collapse of public sector healthcare. Okay, so what lies ahead? How do we plan for growth? Recovery will look different for different industries. Those industries in the thriving markets will continue to grow despite the challenges. These industries are not affected or even benefiting from the pandemic. Under the thriving markets are electronics, digital technology, online selling, big pharma companies delivering or manufacturing vaccine or supplying vaccines, and COVID-related drugs. Unfortunately, funeral services, because of so many deaths across the globe, they benefited from this. Hospital delivery services. Under the U-shaped recovery, a drop in the economy which stagnates for a while before relatively a healthy rise, the duration of which is 1 to 2 years. Economy takes a few quarters to bounce back. Industries covered by this are small pharma, formal and informal services, formal and informal retails, and food industry. The worst and most dramatic type is also considered a depression is the L-shaped recovery. Sharp decline in the economy followed by slow recovery period. Industries covered by this, affected by this are travel, transport and tourism, entertainment, fitness, personal services, garments. Now, let's take a look at the macroeconomic and employment forecast for the Philippines. In a survey conducted during the period of April 21 to May 1 in this year, the second quarter consumer confidence result showed improvement in consumer confidence index. Though still negative 4%, it's a remarkable improvement from a record low of negative 52% in Q3 of 2020. Outlook for next quarter is low of negative 2.3% and a high of 9.2%. In the next 12 months, it will improve to 15% to a high of 45%. In comparison, Germany, the biggest economy in Europe, due to the resurgence of COVID-19 nearing the Christmas season, the remaining hope to recover from the pandemic is projecting a consumer confidence index of only 1.5 ending this year. The reason why I'm comparing this because Philippines is a middle income economy while Germany is a wealthy country. So even wealthy countries suffered so much from this pandemic. This pandemic became an equalizer for the different economies, and it brought about cooperation of different countries working together to combat this disease. Increase in consumer confidence in our country is attributed to relaxing of quarantine restrictions, thus opening up the economy, increasing vaccination rate, and influx of overseas remittances going to the holiday season. Now, what is the economic growth projection for the Philippines? Philippines is seen growing fastest in the ASEAN 5 in 2022. It is projected that we will go back to the pre-pandemic growth level by second quarter of next year. GDP growth projection for 2022 is between 7 to 9%. In 2022, we are back on track in achieving the upper middle income country status, joining Malaysia, Thailand, and Indonesia. In 2020, Brunei, Myanmar, and Vietnam were the three ASEAN countries which posted positive GDP growth despite the pandemic. Philippines was the most affected, posting negative 7.6%. But ending this year We are toe-to-toe with Vietnam, projected to grow between 6 to 8% in GDP. And as of today, Philippines occupies 33rd place in the world's biggest economy. We are just short of 6 billion US dollar in dislodging Argentina in the 32nd place. Indonesia remains to be the biggest economy in the ASEAN region, occupying 16th position. Thailand is number 26, Malaysia is number 36, and Vietnam is number 41. Now, let me show you the Philippine pharmaceutical industry capability. We have a capability for research and development for natural and synthetic drugs. We can manufacture solids, liquids, semi-solids, topical, dry powder, effervescent, parenterals, and injectables, except vaccines. We have an efficient warehousing and logistics and distribution facilities. We can do clinical and bioequivalence testing. We have several testing centers across the country. And we have a strong government and private partnership nowadays. For the ASEAN pharma industry, we want to step forward in 2022 as a vibrant, invigorated, proactive, and collaborative ASEAN pharmaceutical industry. ASEAN will continue to become the growth corridor in Asia post-pandemic. Let us make this happen by working together, sharing our expertise and knowledge. I thank Informa Markets for organizing CPHI Southeast Asia. Through this initiative, we can share our experiences and learn from one another. Thank you and have a good day.
Thank you very much, Sir JP. So I think this is quite comprehensive information that the audience get here. I think we have about 15 minutes. I'm going to direct to the question, Sir JP. I see that the number of the vaccination rate, it's not yet 50%, and you mentioned by next year it can reach to 70%. However, I see many cities already in ASEAN start opening. How can you explain more about how is the situation in Metro Manila? It is getting already 70% or how?
Yes. The bulk of the GDP, like about 40% of our GDP, is contributed by the Metro Manila and the region near Metro Manila. So the government, in rolling out the vaccination, they prioritized this area so that we can open up the economies of the biggest source of GDP. So currently in NCR, National Capital Region, about 85% of the population are already vaccinated. The North Luzon and South Luzon area is already nearing 50%, but the rest of the country are still below 20%. Most of the cities, trade centers across the country are with above 50% vaccination rate. We are opening the economy because currently we are on alert level 2, and we are projected to lower it down further to alert level 1 so that we can prime again the economy. But we are worried of the new variants, the Omicron variant. That's why we already closed our borders to countries identified with this new variant.
All right, thank you, sir. I saw the slogan. I really like it. Make it happening. Make it happen in the Philippines. That's really like it's very easy to understand. And you are part of the Make It Happen in Philippines.
Yes.
Of the vaccine facility. So right, I want to ask you, like before having the vaccine facility, all the vaccine is import, right?
Yes, imported. Actually, the vaccine facility that is available right now are only for the fill and package. So we are importing the bulk from China, and Russia. So we are doing the filling so that we will not burden other countries in the production of it. So we can just import the bulk and do the filling ourselves. But we don't have yet the high scale facility. By the end of this year we'll be achieving about 70% of herd immunity, but we'll still need the booster shots. So we need another 110 million doses for next year. So having a manufacturing facility of vaccine here in the Philippines will help so much. That's the reason why starting next year, the government will focus on establishing a vaccine facility, full vaccine facility here in the Philippines.
So what type of vaccine that Filipinos getting in 2021? It is the
Yes.
I heard some Pfizer.
Yeah, no, it's actually Sinovac from China
Sinovac.
for the bulk fill. But in terms of the different vaccines we are getting, the government are procuring abroad, and some government-rich countries are donating to us. These are mostly Pfizer, AstraZeneca, Gamaleya from Russia, but about 50% are Sinovac and Sinopharm from
So
China.
yeah, I understand that Philippines has more than 1,000 of Iceland and people
Oh, yes, land.
from from north to down south. It is pretty challenging on the transportation. Any issue happen with the pharmaceutical transportation or logistic during the pandemic, and how you see those challenge would getting better in the future?
Not so much because even prior to the pandemic, we have a strong logistical system, and the pharma industry in the country is robust. It's huge. It's a huge market. So we've been preparing already for this. We have cold storage across the country. So it's not actually a problem in terms of distributing and storing these COVID drugs across the country.
All right. So now come to the very interesting one. It's called Philippines Pharma Roadmap, right? So
Yes.
you mentioned that in the presentation, you mentioned about 60% is import.
Yes, yes.
From either China or India. So may I ask on the detail, just a brief detail, what is the goal in terms of the Philippines Pharma Roadmap? What percent you want to achieve?
Okay. Currently, about 40% of the drug products marketed here in the Philippines are imported. So in the next 5 years, our target is about 60%, going to 70% in the next 10 years. Of course, we cannot manufacture everything from the Philippines. So we will focus on certain drugs that we have capability, and we are competitive in terms of cost. We can have large scale manufacturing and be competitive in terms of pricing. So that is our goal. In the Philippine Pharma Roadmap also, we need to strengthen research and development, especially for the herbal drug industry, because we really cannot compete with Indonesia, with China, with India on synthetic drugs, on generic products. We don't have capability to come up with new molecule. So it will take us a lot of time, and we cannot recoup the investment unless we market it outside of the Philippines. So we will focus on certain capabilities that we already have, the herbal drug industry, and leveling it up to achieve the pharma grade, not just food supplement grade. And then on other research and development, we need not reinvent the wheel. We can partner with innovators and transfer the technology here in the Philippines. Offer our manufacturing capability, manufacturing facility. Because we have lots of skilled persons, skilled graduates here in the Philippines, engineers, pharma graduates, doctors. So we have many scientists. So we are competitive in terms of manufacturing, but the government has to help us in terms of the registration, in terms of lowering down the cost of electricity, power. Okay.
Yeah, I can see that the development on the pharma roadmap, if I understand correctly, that there is a group of stakeholder identify that what drug is best to import in, remain
Yes.
import, and what drug we have that capacity and
Yes.
we can produce, it will be for domestic or even find a market for export. And now touch on the herbal medicine, meaning like Philippines also have direction to be self-sufficient on what you can produce, which means the drug security. So JP, can you explain to the audience here that the roadmap here also consider on the drug security in Philippines, apart from setting up the vaccine facility, welcome the innovation and technology transfer. How PPMA working in terms of achieving the drug security in Philippines?
Okay. Drug security doesn't mean manufacturing them locally, everything. Drug security means that when it is needed by the population, it is available. So it is strengthening the logistical process, partnering with suppliers abroad of raw materials and packaging materials. To a certain degree, manufacturing it locally will have an advantage because we just import the raw and packaging materials and we maintain certain inventories of those raw and packaging materials. And we have options to get those raw and packaging materials from other countries and then do the manufacturing ourselves. During the pandemic, since most of the drug products are imported, and China, India, and a lot of countries imposed a moratorium on exporting their own drugs and medicines. So suddenly, we're out of stock. Whereas if it is locally manufactured, we maintain certain stock level of inventories of raw and packaging materials. We can easily convert it in finished goods. So we want the experience out of stock. And if the raw and packaging materials are not available readily, then we can get it from somewhere else where it is available. So yeah, it's strengthening the partnership with several suppliers, is strengthening the process at the FDA, Food and Drug Administration, in order to hasten the registration so that if we will do variation or get some other sources, then we can easily do that. So that's part of the drug security roadmap.
Yes, I work with you for a few years already. I can see that your aim also trying to expand the network in ASEAN in order to get the pharmaceutical products in ASEAN into Philippines as well, not only from India or China. So the next question is coming from our audience, Sir JP. Do you have any idea on the free trade in ASEAN for the pharmaceutical products, or any harmonization that the implementation that the medicine produced, let's say from Thailand under the PICS GMP already could get the faster lane of the review on the generic drug, for example?
Yes, actually, it's been about 10 years that we are talking about harmonization. But unfortunately, it is not yet 100% realized because certain countries, specific countries, has its own regulation. But to a certain extent, we compromised on certain guidelines, and most of which are already working for us. Uh, in terms of PICS registration, PICS accreditation, the Philippine FDA is not yet PICS accredited, though the guidelines that are being used are the PICS guidelines, but it is not yet recognized outside of the ASEAN. But within ASEAN, it is recognized. So, in terms of the registration requirements, it is much easier nowadays for some countries to register their drugs here in the Philippines, or the Philippine products to other ASEAN countries. But outside of ASEAN, it's still very difficult.
Yeah, so now I think the question is from Thai audience here. So JP, let's say if we are selling Thai farmer want to sell the generic drug into Philippines, can I advise them here that please contact please contact PPMA in order to get more idea and could be
Yes.
yeah.
Again, Philippines is the second biggest pharma industry here in ASEAN, second to Indonesia.
Yeah.
So the growth rate I already shared with you, it's trading between 7% to 11%, except last year. So we have huge population. So there are opportunities for business here in the Philippines, specifically for the pharma industry. A lot of foreign companies in Europe and USA are coming into the Philippines, but rather partnering with them in US, in Europe. Why not partner with ASEAN? We are brothers.
Right. Yes.
So
that's very powerful message from you that the ASEAN collaboration would be the next step that we should across the association we networking together in CPHI Southeast Asia and move to the next level of collaboration.
ASEAN totals 500 million. So it's a huge market, and the growth is here. In 2050, the projection in the next 30 years, the projection is more of the ASEAN countries will enter into the biggest 25 biggest economy. Philippines occupying 18, Vietnam occupying the 20th position in the biggest economy by 2050. Thailand will be retaining its strength because Thailand has fewer population, those that will be thriving are those with the population more than 100 million. So that's why Vietnam, Philippines are in for a bigger growth in the future. Of course, Indonesia, big with 250 million Indonesians. So the growth corridor is here in Southeast Asia. So we can cooperate with each other, exchanging technologies, exchanging expertise. That's why CPHI Southeast Asia is a great venue to enter into partnership, to enter into collaboration.
All right. Thank you, Sir JP. That's it's our time to close this session. And to the audience that want to see the on demand again, you can go to the CPHI Southeast Asia digital event from now to 10th of December to enjoy what Sir JP has shared with us in the session and more of the topics from ASEAN country. Thank you very much, Sir JP. And hope we could catch up again in the next session.
Yes.
Next level of collaboration among ASEAN. Thank you very much.
Thank you very much, Rose, for continuously inviting me. Thank you.